Hi everyone, welcome back. So following on from my video on the benefits of pregnancy massage, I am today going to be talking about massage for the postpartum period. So just following on from the labour itself. So I'm going to be combining my knowledge today of from being not only a massage therapist but also from being a midwife and also a surgical nurse. And I'm going to be talking about firstly massage and how it can benefit following a natural delivery. And then I'm also going to go on to talk about specifically how massage can help following a caesarean section delivery. But in general, massage is effective not only in easing, the physical transition into motherhood and sort of counterbalancing all those changes in the body that have occurred during the pregnancy, but also in helping with the emotional transition into motherhood, which sometimes can be much more difficult, and certainly obviously postnatal depression is something to sort of consider there. And I will be actually doing a video in the future on how actually baby massage can really help with mums who have postnatal depression. So that's another one to look out for. So for now, as I say, I am going to talk about immediately following on, from the delivery of the baby. And we're going to start that by talking about natural delivery. So how soon, can you have a massage following having a baby? Well, it's quite easy with a natural delivery in terms of sort of how soon you can have a massage. Not that the delivery is necessarily easy. Postpartum massage can really be done, from a couple of days after the labour, in order to help assist with this transition into motherhood. And I'd say it's equally as important as the pregnancy massage. Quite often, women will go and have massage when they're pregnant, and then it's almost like the benefits suddenly stop, but actually it's equally important. So let the dad or the grandparents look after baby for a while, and go off and have some me time, because it's really important. Easier said than done though, I know. Okay, so the benefits in terms of that immediate postpartum period, as with all massage, relaxation is a big thing. You've just had this baby, you have you barely feel like you've got a minute to yourself. It can be physically and mentally quite exhausting, but massage will really help with the relaxation and also stress reduction. We know this. We know that through the effects, by boosting the circulation, and by the effect on the, hormonal system, massage reduces the cortisol, which is your stress hormone. It relaxes the muscles, and just makes you feel, in that sense, just less tense, and just promotes as well the release of all those feel-good endorphin hormones, which also includes the oxytocin, which of course comes in and helps out with the breastfeeding and the bonding following labour. As I sort of briefly mentioned at the beginning, about postpartum depression, Massage can be great at helping to reduce postpartum depression. Approximately 65% of women suffer from the baby blues, which is normal. And that's due to obviously all these, changes again in the hormone levels following the labour. And also due to just balancing those new responsibilities, really. But 10 to 15% of these women who have the baby blues, it develops into, postnatal depression, which is much more serious. Massage can certainly help by helping to regulate the hormone levels. And again, reducing these stress hormones, bringing in the endorphins. But as you will see if you watch the video that I will do on postnatal depression, massage certainly is not a treatment on its own for postnatal depression. It is to be used in conjunction with other treatments, but certainly it can help just balance out those hormones a little bit following the delivery. Massage, as we said, it increases the blood circulation. So again, working on things like any residual, fluid accumulation around the feet and the legs, and just really, boosting those iron levels as well, which we know, during pregnancy, iron deficiency anemia is quite common as well, and just really giving those energy levels a bit of a boost, which, is going to be much needed when you're sleep deprived and, carrying baby and just, not really having much me time. Another benefit, which again I'm going to do another video on, is in terms of improved lactation, improving the milk flow to the breast tissue to assist with any breastfeeding problems. I will do another video on this, and I will actually be showing you how to do self-breast massage in order to assist with breastfeeding issues. So I will really talk about sort of how that all works and the benefits of that in that video. Pain relief, even if it's been a natural delivery, again, it's still quite painful and you can feel pretty sore, for a few days afterwards. And, even more so if you are one of those fortunate women to have a really big baby. You're going to feel a bit sore. Again, if you've had, a tear, you're going to feel really quite achy for a good few days afterwards. But also generally, just in terms, again, of these changes in the hormone levels, massage can be used just to relax those aching muscles, particularly, around the back, but also around the shoulders and the arms and the neck, once you're sort of suddenly carrying baby, and you're probably propping baby on one side and then, trying to sort of, get the feeds ready with the other hand or whatever it is you're doing. And that can, in itself cause imbalances in the shoulders. But also, aching muscles resulting just from the pregnancy itself. You've had 9 months of all this extra load and altered posture, and that's going to take its toll, and it's going to take a little while, to kind of resolve that, afterwards. If you're breastfeeding, again, it's going to have an impact on around the shoulders and the neck, just because of the position. and just generally, as I say, just childcare, lifting a baby, and maybe you've already got a toddler, and you're lifting them, and so lots of sort of factors to consider in terms of sort of why you may be experiencing pain and muscle tension. And as I say, even if you've had a tear during the delivery, maybe you've had to have an episiotomy, maybe you've had an assisted delivery, so something like forceps, which is pretty uncomfortable. So it can just help with sort of residual pain from these issues. And quite often, of course, if women are breastfeeding, they don't like to take painkillers. You can take sort of like paracetamol, but quite often a lot of women who are breastfeeding, they would just rather not take painkillers. So massage is a really good natural way to try and deal with the pain. So we've touched on obviously the hormones, the balance of hormones changing again following the delivery. Your estrogen and your progesterone levels are going to just rapidly drop because you no longer need that extra sort of thickening of the uterus, and so but the prolactin and oxytocin will increase to promote the lactation, and also they help promote that bonding with the baby. So massage, by helping to regulate these hormones, it just helps to encourage, a smooth transition into motherhood, and also by reducing the, norepinephrine and the cortisol, the stress hormones, which again, by reducing these, it's going to help to reduce those anxiety levels, reduce the stress levels, and hopefully reduce postnatal depression as well. We talked a little bit about at first about the circulation and helping to reduce any residual swelling, fluid accumulation, particularly around the feet and the legs. So massage will really help to help the body to return to its pre-pregnant condition. During pregnancy, fluid volume increases by 50%. But massage, by increasing the blood circulation and the lymphatic circulation, thus also helping to get rid of waste products, through also regulating the hormones, stimulating the tissues. All these things are going to help to reduce any residual swelling, and accumulation of fluid, which again is going to just, make you feel a little bit better about yourself, and hopefully a little less tired and sort of weighed down. We have, in talking about the hormones, we've sort of mentioned again about lactation. So certainly improved breastfeeding is a benefit. Again, massage increases the secretion of the prolactin, which is your lactation hormone. And it also, just through relaxing the muscles around the neck and the shoulders as well, can just really help in terms of positioning, and just feeling relaxed when you're breastfeeding. Sometimes when I've witnessed mums, having problems with breastfeeding, sometimes it can even just be something as simple as, mum's just feeling a bit stressed out, and baby picks up on that, and so maybe doesn't latch on quite as well. So massage can help in that way. But again, I will talk about breastfeeding in the other video that I'm going to do. Improved sleep. Obviously, we've talked about how massage can, reduce stress levels. And just, just by doing this, it can help consequently with, having a better night's sleep. Massage has been shown to increase specific brain waves that are actually linked to deep sleep, and therefore promotes relaxation. And, if you're getting a good night's sleep, you're going to be, combating the fatigue that comes not only following the labour process, but also just with that new responsibility and, sort of altered body clock, and because you're having to fit around baby's body clock, So, yeah, good night's sleep will just help maintain those energy levels a bit better. And generally, just even in terms of a natural delivery, just in terms of helping the body, obviously we've talked about helping the body to restore, back to its pre-pregnancy condition, but also in terms of, just speedy healing. Just because you're not having a cesarean, just because it's a natural delivery, you may still need some assistance, say in the form of forceps or ventouse, or let's say if you have a tear and then you need an episiotomy, just to make more room for baby to come out. All these things still require healing. So massage can just really help, just as a sports massage would help, with faster recovery time following a sports injury, or a sort of really hard going training session. Postpartum massage will really help just the body's tissues to just heal themselves, following these sometimes traumatic experiences, during the labour. So that's natural delivery, and as I say, I'm now going to talk about postpartum massage, specifically aimed at following a caesarean section. So massage following a caesarean should only happen once the wound is healed, pretty much healed, once pain levels are controlled. And so I would usually say at least 2 weeks following the surgery, sometimes longer depending on the wound healing, and this is really to avoid the risk of infection in the wound site. If you have an infection while breastfeeding, this is going to affect the baby's immune system. And, even though the scar may seem healed on the outside, it takes a bit of extra time, for things to heal on the inside. But, even so, if there is still a little healing, it's still possible to do a leg, foot and a back massage. You just wouldn't do sort of obviously around the stomach area. So, there are ways around it. So in terms of the benefits of massage specific to following a caesarean section, we've just talked about healing. So certainly the massage will help, improve healing time, stimulate the processes needed for the tissue to really properly come together, both on the inside and outside. And as we know, massage actually also helps to reduce the risk of adhesions internally following surgery, and to help reduce sort of overgrowth of scar tissue, and just minimise the appearance of scar tissue. And again, I will do another video in the future on the use of massage for scar tissue. And massage obviously increases the blood circulation, which again is going to help with the scar tissue and the healing, because it's going to be bringing in oxygen and nutrients to the tissues. And also in terms of, again, if there's been blood loss during the surgery, that increased circulation will really help in terms of production of hemoglobin and the red blood cells, which will help combat sort of any iron deficiency anemia due to blood loss during the surgery. As we know, massage also helps to ease pain, not only in terms of muscle tension, but this, obviously there's going to be increased tension following surgery. And just in terms of while you're healing and you have that pain, you're going to be holding your body a little bit differently, to kind of compensate for those painful areas. And so massage can also help any aches and, muscle tension that builds up in sort of other areas that are compensating. And just generally, promoting overall health and well-being, following your caesarean. So now we've mentioned briefly there about scar tissue. So as I say, I will be doing a more in-depth video about scar tissue in general, but how does massage help, in terms of scar tissue following a caesarean? Well, as we said, improved blood flow certainly allows for better healing, because it's helping to bring oxygen and nutrients into the tissues, and helping obviously combat any iron deficiency anemia that we've mentioned. But also scar tissue actually, it grows in various directions. And so in terms of pelvic surgery, this means it can actually, scar tissue can adhere to surrounding organs, so the bladder, the uterus, potentially this can cause organ dysfunction. It can cause pelvic pain, it can cause back pain in the future, and these adhesions, they're on the inside, you're not going to see if they're there or not, you're just going to know, that maybe suddenly you're feeling a lot of pain. And so, so massage can really just help get on top of that and help prevent those adhesions, from forming, and therefore prevent these further complications of pelvic pain or, sort of bladder problems and things like that. Now, obviously following any surgery, the healing, it does take time. As we've said, it takes longer for the sort of inner healing to happen. So even when you think the scar is healed on the outside, there's still healing to do on the inside. Healing can be slow, it can be painful, but massage will just, by helping to maybe just reduce the formation of scar tissue, and helping to reduce sort of the spread of the scar tissue onto these surrounding organs. It can just help, make the healing process maybe a little bit quicker and a little less painful, which when you've got a newborn baby is always going to be a benefit. So now there are some precautions to be taken in massage following a caesarean. In fact, following any surgery, it's not that there are any oils that are bad. But certainly particularly beneficial oils following surgery seem to be things like sesame, coconut, or vitamin E oil. They're good following surgery. And certainly vitamin E is excellent for scar tissue as well. But one thing to be aware of is that particularly if you're breastfeeding, baby doesn't like maybe some oils. Certainly sesame has a very strong smell to it. So if you're using these oils and you're breastfeeding and maybe you think suddenly baby's maybe not latching on very well, or then change the oil. So yeah, just to avoid any interference with the breastfeeding. Now, massage following caesarean, it should be gentle, and it absolutely must be done by a therapist who is qualified, to be dealing with not only postnatal clients, but actually also, post-surgical clients as well. So, always check out your therapist experience and qualifications. They're not, if they're registered and they're qualified, they're not going to mind you asking. So, if you have regular massages following a caesarean, also make sure that you see the same therapist as well. If you go to somewhere where there's a few different therapists working, always ask to see the same therapist, because that way they are going to be familiar with how your body is healing, and so they will be able to adapt things, if need be, just to give you a better sort of outcome, basically. And certainly, as I say, if you have a reaction or if baby doesn't like the oils that are being used, do change the oils. It's not a problem. Do wait until your pain has subsided. Now, obviously, you might still have a few sort of general aches and muscle tension related pains, but obviously in terms of the actual wound pain itself, wait until that has subsided before you go and have a massage. And certainly if there were any complications during the caesarean, it's probably best, obviously sort of people coming to see me. I mean, I'm qualified, I'm a surgical nurse and a midwife. So I can kind of assess situations differently to your average massage therapist. But if you have had complications during the caesarean, then I would say generally to seek medical advice. Or even advice, from your midwife if you're still in contact, or which probably at the point you'd be looking at massage following a caesarean, is probably more the health visitor. So probably the GP is your best option there. And that's really, again, just to ensure, that there's, no complications in terms of your healing process. Because, at the end of the day, you want to be in the best sort of form possible for looking after your new baby. So that is really the main benefits of postpartum massage following, natural or caesarean delivery. And as I say, I will be doing more specific videos on breastfeeding and self-breast massage, on postnatal depression, on pelvic floor weakness, and also on abdominal separation. So if these are of interest to you, by all means subscribe to me on here and you'll be notified when those videos come out. And of course you can comment down below. Feel free to contact me through my Facebook or Instagram. If you've got any questions, I will do my very best to answer them. as I say, make sure you see a qualified therapist. But that's all for me on postpartum massage for today. So yeah, until next time, take care and enjoy your new baby. See you later.